cellular etmoidalis. Here, no, it's destroyed here. We're not able to see, but actually it has to be here. So, through the cellular etmoidalis passes the bulb and the tract of the nervus olfactorius. So, that nerve that allow for us smell. Yeah?
Yes.
Perfect. It's located here. The next. This one is not whole. Just for yours. On the fossa cranial artery, that's everything. There is nothing more to show. Now you may show if you want. Here there is here it has to be the frontal sinus. And here you can show here it should be the sulcus sinus sagittalis superior or the groove of the superior sagittal sinus. Doesn't matter. The canalis opticus located in the medial floor, not on the anterior. The next one. The next part. This is the medial floor. So the borders. This is
ala minor.
Ala minor. Sternate bone. The squama of the temporal bone and the superior or the upper surface of the pyramid of the temporal bone. And here, this is the anterior surface of the sella turcica. Here is the same borders. So it starts from here until here. So, here what you have to show. The first one and the most important. This optical canal or canalis opticus. Through the canal path, nervus opticus and arteria ophthalmica, not opticus. The branch of arteria carotid internal. So pass through it. The next one. Yeah, the fissure orbital superior. Through the fissure orbital superior passes. First of all, the fourth or abducens nerve. The trochlear. The first branch of the fifth pair of trigeminal nerve. So this is nervus orbitalis. The six pairs. This is the abducens nerve. And the third pair of cranial nerve, oculomotor nerve. And vena. One vena. Vena orbitalis superior, because of the name of the fissure. That's what's passed through the fissure orbitalis superior. Little bit behind the fissure located one foramen. Foramen rotundum. Yeah, you're able to see that here. Here for you. See? Here. Yeah. Here for you. What? Here for you. Oval, wait. Through the foramen rotundum passes the second pair of trigeminal nerve. So, the maxillary nerve. The maxillary nerve passes. Little bit behind. There is foramen ovale, because it looks like oval. Yeah. Yeah. So through the foramen ovale passes the third pair of the third branch of the fifth pair of the cranial nerve. So this is again trigeminal nerve, and this is the ramus or the branch, mandibular branch. So mandibular nerve passing through. And there is also the plexus of the foramen ovale. And the last one located, this one, the foramen spinosum. Through the spinosum foramen passes the arteria meningia media. So here it passes arteria meningia anterior, and here is media. Pass through it. The next, also here we're able to see. نعم. سن شوية. شوف.
اقول لك كلام عربي تكلم روسي.
Here, this one is what is it? This one. This is apertura carotid canal internal. This one, apertura carotid canal internal. Here is the place where the carotid internal carotid artery will enter to the skull. It's here. And here there is this one already. Not this one, this one. This hole and this hole. This is the foramen lacerum. Lacerum. This foramen is so important to know because there is attachment of one important organ. The cartilage part of the auditive tube. Auditive tube, you know, every one of you, yeah? You know auditive tube?
No.
You don't know auditive tube? No. You know the auditive tube, liar. When you fly to India, take Air
He's
India.
not Indian.
When you fly and just take off the airplane, the pressure is changing, and what's happening in your ear?
Exploding.
Yes. So, this it happened because of the pressure on the ear, and that the oral cavity is not the same. When you are swallowing, yeah, or speaking, opening mouth, I don't know, chewing a gum, I don't know what you like to do. The pressure became equal, and so these fillings gone. So here. The next one. Here what you are able to show also. The body, yeah? No. Of the sphenoid bone. And you remember I've told you that in the body, this is the air provided bones. What does it mean? That here there is the sinus, paranasal sinus. Here you are able to show the sphenoid sinus. Yeah? It's this one. Here there is an air. In two sides of the body, there are two grooves. The grooves of arteria carotid internum, it's here located, here and here. And the same place, at the same place. Here you will show the groove of cavernous sinus. Don't be confused. Here sinus and here sinus. But here in sinus there is a venous blood, and here there is no blood. There is just air. Because much correct to call it the paranasal sinus. The next. Also what we are able to show here. This place. This place and this place. Because here there is, right, the trigeminal ganglion. Here. Trigeminal ganglion. You know the trigeminal nerve? Yeah?
No.
Here there is the ganglion of this nerve. And the last. Here. The hiatus of nervus petrosus major. Everything is easy. Here this thing. The hiatus of nervus petrosus major. Everything is clear. Fossa cranium posterior. is this one.
فصك صح؟
Crani posterior, or the inferior or the back floor of the brain skull. There are just 3 floors: the front, medial, and back. So here are the borders. The back part of the pyramid of the temporal bone, the back surface of the sella turcica. Yeah, and here is gonna be the crista or
اوكسبيتاليس انترن
here is gonna be
انترن
not eminentia, a protuberantia occipitalis, because eminentia is just the upper point. So look what you are able to show here. The first one, the clivus. Clivus, this is formation formed with the connection from the sphenoid bone, the body of sphenoid bone, and the basilar part of the occipital bone. On the clivus located the basilar artery, the vertebral arteries, and the pons and cerebellum. Pons, cerebellum, vertebral, and basilar arteries. Very easy. The next. Here, you're able to see. Can you see? Can you see? I will show.
Yes.
Here, porus acousticus internum. Through this porus acousticum internum starts the canal of the pyramid part of the temporal bone. So this is a fascial canal, this is a horda tympani canal, and other canal that you're going to learn it and pass it. The next one. Also, we're able to see the sigmoid sinus. This one, the sigmoid sinus. Able to see the sigmoid sinus. And here's the same. Here's the same. Sigmoid sinus. On the sigmoid sinus, there is the sigmoid sinus. This is just the groove of the sigmoid sinus. This one, what is it? All students, I don't know why they're
كاناليس
confused.
كوندولاris
This one, correct. This is a canalis condylaris. Yeah, I don't know why all of the students they're confused with it. They say that it's the canalis of hypogloss nerve. This one, no. This is a canalis condylaris, correct. And it's here and here.
فوس
This one, this is a canalis nervus hypoglossus. It's this one.
شو اسمه
Here, it's located under the condylar.
كوندروس
Here,
كاناليس
the
كوندولاris
canalis condylaris. And this one, this is canalis nervus hypoglossus. Perfect. This one, canaliculi mastoideum. This one, canaliculi mastoideum, located here. So it will leave from this.
Canalis mastoideus.
Canaliculi, because it's a small one.
вообще в методичке не написано.
I don't know which methodology you read, but there is no everything, of course. This canal
تعال يحيى
is important because I will explain for you why it's important. Because normally we have the, pressure everywhere. Arterial pressure, venous pressure, and also the skull is not exception. There is a cranial pressure. The kids, they have what they have? Fontanelles. Fontanelles, the fontanelles. I read on the lecture. The fontanelles.
فهمت نو
I read in the lecture.
давайте на русском может быть я понял.
مش اللي فات مش الليكتشر اللي فات الليكتشر اللي قبله برضه عليه حراج
Fontanelles, I read on the lecture. This is the weak place of the skull.
هنا يا اسطى.
that's why
The features of the
بتبقى ورا دايما يقول لك
newborn skull. They have the fontanelle. They have the 6 fontanelles: anterior, posterior, anterior medial, anterior lateral, and anterior the same here. So it's pair. These fontanelles, why do they have it, kids? Because their arterial venosal system is not perfect, it's not completed. If you remember that the lungs, they don't have the pulmonary tract. The pulmonary tract is off. Why? Because the mother, she breathes instead of the kid, if you know.
yeah.
So, gas exchange happen on the mother lungs, not on the baby's lungs. Get it? Hope get it. But kids, they have veins. They had veins, but just they didn't have the pulmonary tract. All this deoxygenated blood went to mother lungs. So this is why they say that it's forbidden for mother to smoke during the pregnancy. I hope you get it. So what's going on here? Here we have the 2 kinds of vein, even 3 kinds of vein on the skull. The first one, this is a sinus. Sinus, this is just a duplication of the dura mater. Duplication, you understand?
Дубликация.
So, because dura mater has 2 layers, but this one, when you will start the learn nervous system, you will get it. The second, this is the diploic vein. The diploic vein, kids, they don't have it perfect because the ossification process starts to complete it. So I've said for you, when they just born, even they don't have the paranasal sinuses because they didn't breathe, they don't need it. So what the meaning of this? I said for emissary veins. There is emissary vein and diploic veins. All of this vein plays just one role. They're regulating the cranial pressure. So for example, when you said that I have a headache, that's wrong that you said it. You can't have a headache because the head is just a bone. What can hurt you? Nothing. There is just a cranial pressure. So when they say for you, when you have a high pressure, what they offer for you? To do massage. Where to do massage?
Here. Here.
And the different parts, so occipital part, the parietal part, in the different part. Why do they say that? They say because this is the closer part to the diploic vein. Veins, if we are going to compare it with arteries, remember, veins, they have valves, yeah?
Valves, yeah.
But arteries, also they have an exception. There are arteries, because they will tell you that there are no any arteries, and maybe at school they've told you that there are no any arteries with the valves. So this one, for you advice, I argued with one teacher about it, and she told me if you find the artery with the valves, I will give you the 5 points grade.
What?
Great.
Again, please, again.
And when I argue with her, you know, I found them, and I found the 2, and I can find more. And when I argue, this is one more piece of advice. Never argue with the teacher. Because after you're going to have a huge problem. Not a big problem, the huge problem. There are artery, and I've said for her, she didn't put for me 5. She didn't allow me even to come on exam. After that. Because she said that I put her down in front of everyone. So, aortic, this is an artery. This is an artery, because there is arterial blood. In aortic, there are valves. Okay, she said for me, the valves of the heart. Okay, no problem, but there is another vessel. also located on the heart, but this vessel has an arterial blood and it has in all wall its valves. And this is a pulmonary artery. And the pulmonary artery, valves located not on the heart, they're located in the vessel. I said for the pulmonary artery. She says for me, I didn't mean like these vessels, and she started to go away from it, and after I found the 2 points greater in my point, so never argue. Why I'm speaking about this, when you are doing the massage, you open the valves. You're doing massage, the valves are opening, and the blood started to leave. So all of the pressure what was here, it's leave the skull
Where can we
with
do
the blood.
massage?
The massage, why they say always, the temporal bone or the occipital bone? Why they say? Because here is the place you may find. You are doing massage for these. You're doing massage for this vein. This is why it sleeps fast. Blood, it sleeps fast. This is why the headache is gone.
فرق.
Get it? Here is also located the emissary vein inside of this bone, inside of protuberantia occipitalis externum. Here there is also, and in the condylar canal, also. Yeah, also located the emissary vein. Diploitic vein, they located inside of the bone. So, the next one, this one, this hole, I will show here.
كل ما راح شمال يقوم رايح.
كانالس
عند اسمها الفرن صح؟ عند الدايره اسمها فرن فرامن عند
This one, this is the jugular foramen. Jugular foramen. Why you should know about the jugular foramen? Jugular foramen, if you remember, it separates on two parts with the intrajugular tuberculum. So this one, this one, I will show for everyone. This one is intrajugular tuberculum. This one, you see? This like triangle, you see? This one, the sharp edge here, you see? This one, you see? This one is jugular foramen. This one intrajugular tuberculum. You see? It's a triangle shape and the sharp edge, you see? See? You see? So, this, through this foramen passes, also it divides on the anterior, lesser, and the posterior, bigger or greater. Through the anterior, remember, it doesn't matter that it's lesser. Through this small foramen passes three nerves. The glossopharyngeus nerve, the vagus nerve, and the epithorius nerves. Just three nerves. And from the greater, the back, pass just one vessel. And this is the jugular vein.
Jugular vein to supply the...
But even much correcter to say the superior or the upper bulb. The upper bulb of the jugular vein. Get it? And the next important formation, foramen magnum. The foramen magnum, this is foramen too important. This foramen, the border between the spinal cord and the brain. Remember, where is the border? Because equal from here, start from here, the segments of the spinal cord. And this one, that students, they forget about it. When they forget the skull, and after when they come to the central nervous system, and I've started to explain for them the segments of the spinal cord, they forget one thing. That normally the amount of segments is the same like the amount of the vertebrae. But there is one exception, the cervical part. On cervical part, on one more. Because the border between the brain and spinal cord is foramen magnum. And segment will start right from here. So this is why it's on one more. They always forget. And the last that you are able to show, this is the groove of transverse sinus. Or sulcus, how as you want.
Так, у нас проблема появится на экзамен. Я учился на латинском, вы сдавали вопросы на английском, поэтому я просто...
No, the question was on English, but the answer was on Latin.
Если вдруг мы не поняли, что написано...
No, it will be in Latin. On exam, it will be everything Latin.
Так, я хочу сдавать.
يا عمي خلاص بقى اسال عن سؤالك ده عمالكم يا جدعان.
خليه يشرح لنا خلاص.
The next, we'll speak about it later.
صح كده. وصلك قد
So, what else? To show.
After study, everything will be easy.
After study, of course, everything will be easy. It's not too much here to show.
So easy, bro.
So easy, yes.
It's interesting, bro.
So, and I will ask you one thing. Your homework will be someone write it. Canal of the temporal bone. I need just 7 canal, just 7, not 8, not 10. I don't need it more. When I've studied, I found this 31 canal. 31 canal of temporal bone.
31?
Yeah.
You only have to find stuff.
Just 7. They're on the book.
In the exam,
On the exam, 7 you will have.
Doctor, we have 31.
You have it more there.
More than
Maybe 100 and more.
Dr.
Because I've explained for you. There I've said for you that there is diploic and emissary veins. These veins, they goes and they separate on lots of branches. And this is also the canal because there are holes on this bone. So right now the clinical aspect. Someone of you who is going to work in the traumatology department on general surgery or who wants to work at the neurologist
нет, невролога.
or neurosurgeon, I will explain for you. After the car accident, lots of people, they come with the raccoon syndrome. You know the raccoon syndrome, yeah? This one when they have bruises around the eyes. And all of the people, they come, and by the way, these patients are not contact. They're too difficult, and they put them on they're thinking that under the shock, accident shock, and they say that it's nothing is important, and they are putting them in computed tomography. And they put just the facial part of the skull. And I will make you sure that they may not have any breakage of the facial bones. They may not have it. But around the eyes it will be the bruises. So when you see around the eyes bruises, patient are not contact. So you should think about one thing, breakage of the basement of the skull. Here, it means in this part, happened the breakage. So here passes the vena. You remember which one? The jugular internal. Yeah? So this vein will take off the blood from all of the face. So blood supply will go from paraorbital area. Why the person will have the raccoon syndrome? It will stuck blood on the vein. It won't go anywhere, and blood will pick up here. This is why you are able to see this raccoon syndrome. And people, they are in lots of clinical cases, they are just doing the face of the facial part of the skull. You have to know that you have to do of all the skull, and much better of the cranial part. The next part,
Is it curable?
curable,
Curable, yes.
of course.
It's not treatable, right?
If it's without like changing position of the bone, then nothing important.
But I remember last time you said if there's a raccoon syndrome, the person will die.
Yeah, but if it's without changing the position of the bone, like for example, the bone didn't move anywhere, it's normal for the person. If it's the position of bone change, how you will put the here? Just imagine how will you enter there? How will you enter there?
It means the God will decide.
So it's time to go.
Go
I
ahead.
mean, for the person,
Ah.
it's time for him to go,
Okay.
Go.
to leave.
Neighbor.
So the next, the weak part of each area. On the fossa cranii anterior, there is the weak part. First of all, the weak part, this is this part. This part, this is the ethmoid bone. The cellular ethmoidalis, this is the weak part. So, breakage in this part, you will detect it at once. By one asking, can you smell something? They won't feel anything. There is a breakage here. He will have a bleeding from nose.
У меня сломалась несколько раз.
Вот.
Ну,
This one, it's impossible. If it's
ну,
break,
я имею в виду нос.
the nose, it's nothing.
بيقول لك الحته دي
It's nothing. It's broken and broken. Doesn't matter. Also, the next part, the next week on the fossa cranii media or in the medial floor. The weak place and the dangerous place, the most dangerous place in all of the skull, this is the squama of occipital bone. This is the most dangerous place.
Когда мы
This is why
получим удар здесь, это вообще самый, ну,
the person will die, but it won't die because you will shot him here. Yeah? Because you will swat him here. He won't die from it. He will die because of the bleeding. Here, this bone, this squama, normally squama, this strong part, the hard to break, but exception this bone. If someone punishes the person here or hit the person to this area, the bone will break on lots of small sharp edges. These edges will enter to the vessel. And this part, vessel, they're magistral. You know the magistral.
магистраль,
Yeah,
это артерия, артерия,
These are the huge arteries.
артерия.
So they didn't give any branches. And the pressure in artery, you remember that it's bigger than in vein. So first of all, with just the pressing on the artery, you won't stop this blood. And here, if you will even press more, you will break the bone more. These sharp edges will enter more to the artery and he will die faster. So, this is what forbidden to do. The next weak part, this is on the fossa cranii posterior, this is a basilar part. Here, this is a basilar part, this is a weak part. The basilar part.
Mars basilaris.
Basilar part, this is also weak part. Why is it weak part? Because in lots of clinical cases, this one, they call it the terminal, in clinic they call it the terminal part. Why do they call it the terminal part? Because the terminal part, this is the last part, so if there is a breakage here, 95% person will die, only 5% luck of his luck. So, that's all by floors.
اسحب كافي السني
So in the frontal is the ethmoid, over here is the squamous, and here's the
Yeah,
basilar.
and the basilar part. This is the
أو
weak part.
كليفوس كليفوس.
Clivus, this one. This one. So you may see right now if you have some question you may ask. Let's take a break a few minutes because I can't read.